Hi there. This is a brief video about how we review and potentially clear warnings about UKMEC. Now, it may be that you've been given some patients to review, or you may see the pop-up that's going to come in a minute when you're actually in a patient notes. So we can see on the home screen, this is a test patient. I've put them on a combined hormonal contraceptive. I've completed a questionnaire for them and deliberately put in lots of answers that suggest things of concern. If I come to the prescribing overview, you can see all the different things that are flagging up. And you've got this 3-star here, which means that if you right-click an action, it will give you some more information. On these, there's a bit of info. They're hopefully fairly self-explanatory. This particular one is one we've had a few queries about. So here, it's a bit more of a slightly grey area. As I understand it, and we're looking at kind of if there's 2 or more of smoker, obese, raised blood pressure, diabetes, and so on and so on. If I action this, I'll get this, and which gives me a sort of summary of what's going on. You may also see this suddenly pop up at you, so that might be if you're prescribing a combined hormonal contraception, or if you put stuff in the record that suggests that they need review. So it may be that someone gets this and they're not themselves a prescriber or a nurse, in which case they can always click the option task to review. It might be that the patient has actually stopped taking the pill. So you can do that and that will take them off the alerts because it will code the fact that they're off the pill. Or you might want to review reasons. So that will bring up this view and you can see again the information here. And you can see a bit more about what's driving this. So these 2 codes here have been added from the questionnaire about patient's immediate family having had a blood clot, in this instance below the age of 45. The multiple risk factors, so you can see that they're a heavy smoker, the blood pressure is raised, and the BMI is raised. The BMI itself is a trigger, the BP itself is a trigger. So there's lots of different things going on here. I guess more realistically, it might be fewer things, but it gives you an idea of what's happening. You may have also spotted, if I just minimize that, this pop-up. Are you sure it's appropriate? So if I click on this, that will take me to the UKMEC summary page, which you might find useful. Expect you're familiar with that, but you can always kind of cross-reference that there. And so we've got options here. If I select yes, it will add various codes that will take these alerts off. It will take the patient out of the reports. But obviously, you should only do that if you're really confident that the patient should be on this medication. Arguably, if they're UKMEC4, there's never a reason to do it, but maybe there's a coding issue. So perhaps someone in the past has coded them with migraine with aura, but actually that was an incorrect code. In that instance, it's probably actually better to mark that code in error. It might be that you've had a conversation with the patient, you want to share the risk, so you can click yes. If I OK that, sorry, it's just thinking about it because it's applying some stuff in the journal, which I'll show you. So UKMEC reviewed and appropriate for the patient, and it's these codes here that our system will then use to say, right, that is now fine. I hope that helps. Any questions, any feedback, any ideas, do let us know. Thanks.